The Inflation Reduction Act became law in August of 2022, and it's had many impacts upon the Medicare program. But the greatest impact of all will be on prescription drug plans for 2025, and specifically the smoothing benefit, which means those that have high out-of-pocket expenses for their prescriptions are going to be able to evenly spread out those payments throughout the year. It's called the Medicare Prescription Payment Plan. In this video, I'm going to talk about the details surrounding that plan so you'll know whether this is something that you should take advantage of or not. All right, I want to begin by starting with kind of a bird's eye view of these changes that have happened since the passing of the Inflation Reduction Act. The first we saw was in 2023, and that would be this: that all insulin that's actually in a plan's formulary was capped at $35. Okay, so there could be no out-of-pocket expense beyond the $35 for insulin covered. That was a big deal because before that it would have been several hundreds of dollars of a copayment. Now also immunizations changed. And so prior to the Inflation Reduction Act, what happened was we had flu shots, pneumonia shots, hepatitis B when that was necessary. Those were covered as immunizations, certainly COVID vaccinations. But the big change was other immunizations can now be covered at a zero copay, and the good one really is the shingle shot, Shingrix. That was typically covered, but there was oftentimes a deductible and a copay. So now that went to zero, or any other immunizations that would be medically necessary. So that was a big change. Then in 2024, we also saw some changes, and that is what we call the catastrophic phase. Catastrophic was actually phase 4 of all drug plans. We still have that through this year, 2024. But what happened was, in the past, when someone got into the catastrophic phase, they had a 5% coinsurance responsibility. But beginning in 2024, that went to zero, which meant what? It meant that the max out of pocket for this year has been about $3,300 to $3,800. So someone could have meds that cost $10,000 a month. It doesn't matter. They would have maxed out somewhere between here for the entire year. And then in 2025, we see three changes. So the first change is this. What we're going to have is we're going to have the donut hole is going to be eliminated. This is actually called the coverage gap, but the donut hole is gone in 2025 and beyond. It's been eliminated. That actually used to be phase 3 of all drug plans. So that's gone. Now, because that's gone, now we also have a spending cap of $2,000. So if someone's on meds that cost $10,000 a month, it doesn't matter. They'll spend $2,000, watch this, for the entire year. That's a big change. Now, the fact is, though, some people have a difficulty even with the $2,000. And that's why what I'm going to talk about in this video is this next aspect that was changed, and that is called the Medicare Prescription Payment Plan. Brand new for 2025. Let's look at those details. Now, this next chart is going to show you why they're implementing this particular $2,000 cap and how this is actually happening. Now, I know there's a lot of information on the board, so I'm going to go through this real quickly. I'm not here to overwhelm you with anything, but this will make sense to you why we have this new plan. So what happens in 2025 and beyond, we only have 3 phases in drug plans, which means depending upon what phase we're in, that will determine what our out-of-pocket cost will be, whether that's coinsurance or whether that's going to be a copay. Now, in 2024, this year, while I'm shooting this video, we've had 4 phases. The catastrophic phase was the 4th one and went to zero. Okay, now we just have 3, again, eliminated the donut hole. So when we look at the cost of medications, what we're always trying to do is we're trying to get to 100% of the cost. In other words, how do we get that entire prescription to be covered? And so in the Medicare system, notice there's different payers, different people that will participate in getting us to the 100% cost of that medication. It could be you, the patient, the one enrolling in the plan, the Part D plan that you selected or it was embedded within your Advantage plan. Medicare pays some of the expense, and the manufacturer is required to also give a discount. Here's my point. We are trying through these different payers to get to 100% of the cost of medication. So our very first phase is called the deductible phase. Medicare sets the deductible. This year it's $590. Some plans have a full deductible, some reduce it, some go all the way down to zero. But if we're in a plan where we have to meet a deductible, what happens? You as the patient are 100% responsible for the entire cost of that medication, whether it's a generic or a brand name. Now, some of you would never even get to the $590 deductible because your meds are so low. Others of you would. could for sure. And so the point is, if we have a deductible, you have to meet that out of pocket. And once we've met it, if we do, we'll move to stage 2, which is called initial coverage. This phase is nothing new. We've always had this. And what happens here, you as the patient, the one enrolled in the plan, whatever the retail cost of that medication, which would be the Medicare reduced cost, you're going to pay 25% of that cost, whether it's a generic or a brand. But the question is, well, how do we get to 100% if you only pay 25%? Well, because the plan that you selected, that D plan, is going to pay the other 75% of that cost if it's a generic medication. If it's a brand name, what happens? That drug plan pays 65%, you pay 25%, manufactured discounted 10%. All right, now once though we're in this phase, now that's when we hit our $2,000 spending cap. And again, I'm going to show you next how we're going to spread those payments out if someone has difficulty coming up with the $2,000. And so, but once we've reached the 2,000, whenever that is, it could be in 2 weeks, could be in 2 months or 6 months. But when we do, that moves us into phase 3, which is called catastrophic. Your out-of-pocket expense is 0, but someone else is going to be paying for those medications. So how do we get to the 100% in this particular phase? Well, if I'm on a generic plan, what's happening is the generic medication, the drug plan is going to pay 60%, and Medicare is going to pay 40% of the cost. If I'm on a brand name, that drug plan you pick out, and that's why it's such a big deal to pick out the right plan, they're going to pay 60%. Manufacturer discounts 20%, and Medicare discounts 20%. Okay, so that's how we get our medications covered. So now what I'm focus on are some very specific details about this $2,000 spending cap. I'm actually going to show you exactly how the math works. I'm going to show you 3 different scenarios: those with high cost of drugs, those with low cost, and those with low cost initially, and then they're prescribed something that's expensive. Let's look at those details. All right, so this chart shows you how the payment plan works. And I actually, along with our producer, we designed this to make this whole scenario make sense to you. So hopefully it will. So again, this is how the payment plan works once you enroll into that payment plan. Now, what I'm going to do before we get into the exact details, I want to teach you this. The very first month that we start a plan, whether that's in January or you'll see an example in a minute, or we start in April, but whenever we start the plan, the very first month on the plan, which many of you will be January, others of you later in the year, but the very first month, they're going to calculate our first month's payment differently. Okay, and so that's why I've highlighted this as I give you an example for January. So here's the formulary to determine what our monthly payment will be the very first month that we're on the plan. Okay, so here's the way it works. First month bill, folks, is calculated differently than all the remaining months in the year. Here's the calculation. They're going to take that $2,000 spending cap, notice, less any out-of-pocket costs. Now, if I'm starting in January, I don't have any out-of-pocket costs, so that's pretty simple. And they're going to take that number, 2,000, and they're going to divide it by the remaining months, which if I'm starting in January, it's 2,000 divided by 12. Or what they do, they'll take the actual cost of my medication. So if that's low, then I'm either going to pay that 2,000 divided by 12 or the actual cost of the medications for my first month's premium. And then every month thereafter, it's going to be different as I get my prescriptions filled. Now, let's go back. If I have a $2,000 cap and I don't enroll until April, and let's say I've spent some money out of pocket, they're going to subtract that number out and take that and then divide it by the remaining months within the year. I'm just trying to emphasize the fact that our very first payment will be different than the rest of the months. That's the formula that we actually follow. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us the thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, so here we go. Let's get started. So first off, this is somebody that has enrolled in the payment plan and they have high cost medications. High cost, we're talking $500, $600 a month above that. Okay, so high cost meds. Now, when we look at this very first month, remember we just said there's a formula that we follow. We haven't spent any money yet as we enrolled in the plan in November or December, but it's going to go into effect in January. So they don't know what we're going to spend yet. They just know we're enrolled in the plan. So what they do, this is what we call the prescription drug carryover balance. We don't have any of that because we don't have any meds picked up. But the actual out-of-pocket cost, let's say we're on meds that cost us $500 when we pick those up sometime during the month of January. So obviously we owe $500 for meds. Now what's happened though, we've enrolled in the plan, and so we're not going to pay our out-of-pocket expense to the pharmacy. You don't do that anymore when you enroll in the plan. You're actually going to be billed by the plan for the prescriptions that you are using. And so what happens is this. They take that $2,000 max spending cap and they divide that by 12. And when you do the math on that, that's $166.67. And what happens is you either pay this or you pay the actual cost of your medications, whatever is greater. Obviously, that divided by 12 is less than our actual cost. And so that is going to be our January bill. Now, we won't receive that until in February, but it's for the January prescriptions. So we had to pay that amount. So they took the total cost of our meds, less what we actually paid through the payment plan, and that's our remaining balance for the month of January. And what you're going to see every time when we come to the end of the month, this balance we owe is going to be carried over into the next month. So we carry forward the $333 into February. That's our remaining balance. Again, we go get meds during the month of February. We're saying our medications again cost $500. So we take the balance plus the new meds. And now for the month of February, I've spent $833. Now they're going to take the remaining months left in the year. Obviously, we're in February, so we have 11 months. They're going to divide that by 11. All right, so they take $833 divided by 11, and that gives me a monthly payment for the month of February prescriptions, very low, $75.76. So they took total cost, less monthly payment. Now I've got a new balance of $757.57. That's going to be carried over into the month of March. So we just move simply from here over to here, same number. Again, I got prescriptions for the month of March. That same cost, $500. So they add the two together. So now I owe $1,257, 10 months left. They divide that out. And so now my new monthly payment for for March is going to be $125.76. Remember what I said? We have monthly payments that are going to differ until we've hit our max on a pocket. And so now I have this balance of $1,131. That's going to carry over until April. Again, I got my $500 worth of retail medications. That gives me a balance outstanding, $1,631 divided by 9 months remaining. Now my payment went to $181.31. And that $181.31 is subtracted from that. And now I've got a balance of $1,450.49. But here's now is what's going to change. Notice what's happened. What's my max spending cap? $2,000. And so in this example, it took me 4 months to get there. Now, some of you, it could be 2 months, 3 months, 7 months. But the point is, once I've reached the $2,000, I no longer have any other financial responsibility. Now, I still owe that for sure. So what are they going to do? They're going to divide that out. That balance is coming over to here. I still owe $1,459. No cost of meds. I hit the cap of $2,000. They take the balance divided by the remaining months. I have a $181.31 payment. And again, this is just going to keep going down and down and down. But you'll notice no more cost of meds. And so my payment is going to be fixed all the way until December. And so whether I would have paid those expenses out of pocket, I would have paid $2,000, or would I spread that out over the 12-month period, I still paid $2,000. So this plan is not going to save you any out-of-pocket expenses. It's just simply allowing you to manage that $2,000 throughout the year. Now let's look at another example. Now this example is someone that is looking at the payment plan, enrolls in it, but they have low-cost medication. They're not spending $500, $600 a month. They're spending less than that. All right, and so again, we're saying they heard of the plan, they enrolled in the plan, but they have low-cost meds. Was this a good decision? This is something that they really needed to do. Let's work through this example. Again, they enrolled in November or December for this to start when it first could start, which is in the month of January. So again, we're highlighting this because why? That first month's payment is going to be different. It's going to be calculated differently. So let me remind you again of the formulary. What's happening? Again, we have a different payment the first month, and so they're going to take $2,000 cap, less any out-of-pocket expenses. Again, we spent nothing. We're at $2,000. They divided that by 12, and remember what that number was? $166.67, and that would be the max payment. But notice what happens, or actual retail cost of my medications. And in this example, we're going to say they're spending $80 a month. And so clearly $80 is less than that, so we're not going to pay that. We're going to be responsible for that for our first month premium based upon this calculation. All right, so now let's go back to our chart as we look at this scenario where someone enrolled in the plan, maybe in November, December, to start the plan in January. And again, they're on low-cost meds, we said $80 a month. So again, the first month is different. You saw the calculation. So clearly we had no carryover balance. It's January. We go to pick up our medications, and the retail cost that we're responsible for is $80. All right, now, again, we're not going to pay $80 at the pharmacy because we rolled into the Medicare Prescription Payment Plan. So the pharmacy is actually going to bill the plan itself, and then they're going to send us an invoice that we have to pay on a monthly basis. And so we owe $80. And so again, the formulary is not going to be divided by 12 because we looked at it. Either we pay the $166.67 or we pay the actual cost of the meds, which is $80, and that's lower, so that's what we paid. Therefore, we have a zero balance at the end of January. Then we roll into February, and now everything's going to change. Our payments are going to be different every single month. You'll notice we had no carryover balance. It was paid off in January. Again, we got our $80 worth of meds. We still owe $80. Now what they're going to do is divide that by the 11 months that are remaining in the year. That just gives me an invoice of $727 that's coming from the Part D plan. I'm going to pay them $727. Therefore, I have a balance now of $72.73 that is carried over into March. Again, we get our $80 of new meds. Now we owe this divided by 10. Our payment went to $15.27. Again, it's applied, and now we have this carryover balance each month. And so you can see what's happening. They're going to take the balance, always divided by the months remaining, and my payment is now going to continue to go up. Now I'm getting $80 of meds, and it looks like to me this invoice, when I get down here in July, has gone up to $45.59 a month. So I'm carrying a balance each and every single month. So that $273.55 that we just saw in the end of June is carried over to July. See, and then again, I got my new meds, $80. I have a balance here divided by the remaining months. And you can see my payment that I'm paying to the Part D plan as they bill me on a monthly basis is going to be $58.92. $74.92, $94.92, $121.59. Now keep in mind, my meds are only $80. So now all of a sudden, plan payments are actually exceeding what I actually would spend. Now we keep going and look what happens up here. Because they spread those out over the year divided by the amount of months, I'm actually paying $241.60. Now that doesn't make this a bad deal because again, I'm going to spend the same amount of money whether I spread it out over the term or I just simply pay the $80 every month. What's my max out of pocket? It's still going to be a total of $2,000. That's all I will have to spend either way. So again, this payment plan does not lower our cost, doesn't save us any money. It just simply allows us to spread those payments out over time. Now, in my opinion, in this kind of scenario, probably if I had low-cost meds and that's all I'm going to have throughout the year, I can't see that this payment plan really is going to benefit me, but you can still enroll, and this is exactly the way it's going to work. All right, just one more scenario, and folks, this is going to happen all the time. This is a scenario where someone enrolls in the plan mid-year, meaning they were on some low-cost meds initially and then got diagnosed with something more serious and had to start a prescription in the middle of the year. All right, so that's the scenario. So again, what's happening in this scenario, we're saying this is a person, in January, they were only taking a $4 medication. Maybe it was a generic, and that was the copay, $4. They paid that at the pharmacy. Clearly, they have no balance because they haven't even enrolled in the plan at all. Didn't need to. They're just paying $4 a month for their medication. So they do the same thing in February. They do the same thing in March. But here in March, they go to the doctor, and the doctor diagnosed them as having AFib, and they're going to have to be prescribed a more expensive medication. It could be Eliquis or Xarelto, typically about $600 a month for those medications. All right, and so they enroll in the plan because they're concerned about having to come up with $600 during the month of April. So they enroll in the plan. So now what's going to happen? Okay, now remember we're talking about the very first month, whether that's April, whether that's November, whether that's in January. When I enroll into the plan, they're going to calculate my first month's premium differently than they will the rest of the months. All right, remember that was that formula that we looked at earlier. So what happens here is this: payment's different, and then they're going to take that $2,000 cap less. Now watch this: any out-of-pocket expenses. And remember what we said? We actually had spent January and February $12. So that's what they're going to do. They're going to take out that $12. So they take the $2,000 less 12, gives us that $1,988, and they're going to divide that by the remaining months left within the year, and whatever that number is will be compared to the actual cost of the meds, and whatever number is the least amount, that will be your first month's billing, and then it's going to change thereafter. All right, so that brings us into April. We're now enrolled in the plan. And so we clearly had no balance because we were just paying $4 a month. But now we go to pick up our medications. We had that same $4 med, but now we also have a $600 Eliquis or Xarelto or some medication that we're getting. And so out-of-pocket costs are $604. We didn't pay that $4 at the pharmacy. We're in a plan now. Again, the plan's going to bill us and give us an invoice for that. So we take the $604. Clearly, that's our balance right now. We have 9 months left in the year. They take the 9 and they divide that by the $604, and that's going to give us a payment of $220.89. So that's the invoice that will come from our Part D plan. All right? And so what's going to happen now, we had $604 less our bill, and now we have a balance of $383 that's going to be carried over into the month of May. Again, we pick up our medications, same cost, $604. Now we owe $987 divided by remaining months. Now my payment went down to $123.39. That's applied to my balance. I carry over from May into June this balance. I pick up my new meds again, $604. I owe this divided by 7. Now my payment goes up to $209.67. You can see what's happening. This balance here is going to start growing. Why? Because my payment's not even close to covering the out-of-pocket expense for my medications. Hey, if you've come to the place where you know you're going to have to make some Medicare decision pretty soon and you want to make the right one of the best ways to do this is to go down below, and you'll see in the comment section there, the very first pinned comment at the top. You can actually click on a link there and you will book a call. And you'll book a call with one of our Medicare guides. All the guides with our company, I have personally trained them. They're professional, they answer all your questions, and they'll show you your Medicare options so that you'll be confident in your decisions. Let's get back to the video. All right, so we carried over the $1,258.05 into the month of July. That was our carryover balance. Now, what happens? Well, we're saying $176 is the only out-of-pocket expense. Why is that? Well, because on that last screen, what happened was this. We eventually, remember, we're at $1,816. What's the most we have to spend? $2,000. And so that's why when we carry over into July, we only have to pay $176 because now we have hit that $2,000 spending cap. So our balance plus the 176 gets us to 2,000. We owe this divided by the remaining months. Now my payment went to $239.01. And now what's going to happen, this will be fixed for the rest of the year. Watch this. So $239 is applied to my balance. I take this, that's July. We carry it over into August. My medications now are zero. I've hit my spending cap. So now we're going to start seeing this balance being reduced. They took the balance divided by the 5 months remaining. $239 payments fixed. Now I'm at $956.03. And you can see what's happening. We have no more out-of-pocket expenses for the rest of the year. We hit our $2,000 cap. And finally, when we made that last payment, now we're at zero. So what did I spend for the year? $2,000. And there's sometimes people could not pay that as quickly if they were just paying for the actual out-of-pocket expense at the pharmacy. And others say, because I can't afford that, I want to enroll into the payment protection plan mid-year. And this is exactly how it's going to work. All right, so in closing, the big question is, if I decide I want to enroll in this plan, how do I do so? Let's just look at some of the aspects of the plan. Number one, enrollment into the prescription payment plan, totally voluntary. You're not required to enroll into it whatsoever, okay? And also, there's no cost to be involved. Again, it's not going to save us money at all. It's just simply going to allow us to manage that $2,000 throughout the year. Number two, it doesn't save money. We just said that, or lower drug costs. Number three, you must first enroll into a Part D plan. So we don't enroll into this first. We actually enroll into that Part D plan. Now, as we move into 2025, what you're going to notice is that there's primarily 6 carriers that are actually offering prescription drug plans. As a general rule throughout the country, we're brokers. We rank for all these companies. But what we're seeing right now is that Aetna, it primarily has 1 drug plan. United Healthcare, which is endorsed, of course, by AARP, has 2 drug plans throughout the country. Blue Cross Blue Shield Anthem typically has 3. Cigna has 3 plans, Humana has 3 plans, and WellCare has 3 plans as well. But the point is you have 15 different drug plans in most markets, not all markets, but most, to actually select a drug plan that's going to be the best fit for you. Now, if you happen to have a Medicare Advantage plan, that insurance company oftentimes will include a prescription drug plan as part of your coverage. So again, once you've selected your Advantage plan or you've selected your standalone prescription drug plan among those that are within your service area, now you're in the plan, and then that plan actually will give you an option to enroll into the prescription drug plan. So pick up the Part D plan first and then enroll in the payment plan if it's in your best interest to do so. You can do so online. Every carrier is to have a place on their website for you to enroll into this plan, or you actually just call them on the phone and say, hey, I want to enroll into the payment prescription plan. And then lastly here, once enrolled, that payment process changes. So let's go back to that scenario where the person took low-cost meds and then got prescribed inexpensive medication. They were not enrolled in the plan. They went to pick up their prescription at $4 and they paid a copay for their meds and paid it right to the pharmacy. But in March, they enrolled in the prescription payment plan for April, and then everything changes. They're going to have to pay their premium to their Part D plan, but also they're going to be paying for their prescriptions to their Part D plan as well. They're going to invoice you for that. That is what is going to change. All right, now let's talk about, in closing, who is this a fit for and who's it not a fit for? And so really the focus here is who it's not in the best interest to take this plan. Number one, anyone where your yearly drug costs are very low. And so we saw earlier where the drug costs were $80 and those payments end up being over $200 because of the payment plan. So if it were me, I just simply, if I have low cost drugs, I just pay those at the pharmacy like you have been doing. All right, now secondly, this would not be a good fit if you're going to sign up after September. The benefit of this plan is to take that $2,000 and spread that out over as many months as possible. But if I enroll in September, then I'm not going to start my plan until October. So I only have 3 months to spread that out. So typically, it's probably just in your best interest to go ahead and pay at the pharmacy for those meds instead of enrolling into the plan. Number 3, if you don't want to be billed for your meds, some people like just going to the pharmacy and paying for their medications. And so if you want to continue doing that, don't enroll in the plan, because we've seen you don't pay at the pharmacy any longer once the plan starts. They'll actually bill you and give you an invoice on a monthly basis. Then number 4, if you're eligible for extra help. Now, extra help is someone that qualifies because of income and assets, low income and low assets or resources. And if those are low, and the government sets certain guidelines, this varies throughout the country. But the point is, if you're getting extra help or eligible for extra help and you're on that program, then you have very low cost meds anyways. Even a $600 medication, you're not going to be responsible for. You'll just be responsible for a very low copay. So this program is not going to benefit you if you qualify for extra help, or if you qualify for what's called a Medicare Savings Program. This helps people with their premiums for Part B and their cost sharing. And so when we qualify for a Medicare Savings Program, we also qualify for extra help for the med. So again, would not enroll into it in these situations. And then lastly, if you're getting help from another organization for your prescription drug costs. Now, one of the most common would be a state pharmacy assistance program. They're offsetting some or all the cost of your medications. You don't need the help. You're paying low cost or no cost anyways. If you're a part of a manufacturer coupon type program where they are reducing your medications drastically, again, you're not going to have that out-of-pocket expense. So this program is, again, not going to benefit you whatsoever. Or if you're getting your medications through some kind of other insurance program, it could be VA or some other system where you're getting those meds paid by someone else or at a very reduced cost. Again, no reason to enroll in that plan either. Okay, so you got to decide, will this help you or not? And so again, if it looks like you do need the help of the $2,000, enroll in the plan and take the benefit of this Inflation Reduction Act of smoothing out these payments for you. All right, so that's the new plan. Some of you, this is really going to help you. Others of you, it's not going to have an impact whatsoever. But if it looks like this is something that will benefit you, enroll in the plan as soon as you can.